Can I really make your acid reflux go away? Yes, actually, I think I can. And especially if you apply the principles that I'm going to share with you and apply them to your own situation. There's actually lots of different subtypes or phenotypes of acid reflux, and that kind of gets at what the causes are. In this video, I'm going to condense all that down and focus on two main subtypes. And this kind of gets at the heart of what the problem is with acid reflux, is that what's causing it is actually important in terms of treating it and in terms of not needing to take acid blockers the rest of your life. And that is the problem with too much acid or too little acid. My name is Dr. Terranella, and this channel is dedicated to helping you optimize your health and body using science and my own clinical insights. So if you're getting a lot out of these videos and want to continue getting videos like this one, hit the like and subscribe button to continue getting these videos. All right, let's jump into the video. Conventional medicine basically treats everyone as if their cause of acid reflux is too much acid. And that actually is not the case in terms of looking at research on causes of acid reflux. There are multiple reasons why this can happen. And so the conventional treatment is to put everyone on acid blockers. We certainly don't want to do that because that's going to increase the risk of vitamin nutrient deficiencies and potentially corresponding other health problems like dementia and other things. And it can also lead to increased rates of intestinal IBS problems and things like small intestinal bacterial overgrowth and other GI disorders. In the more natural or holistic world, we have the idea of hypochlorhydria or too little acid. And so for the treatment for that is to take more hydrochloric acid and similar types of things. Well, there are actually really good case examples where you need to take those acid blockers in order to get yourself out of pain. You may have increased acid production that you need to get under control before you can come off of those. But if you're assuming that your acid reflux is from no or little acid, you're going to start taking hydrochloric acid, and likely a lot of those symptoms, at least the problem from too much acid, has probably gotten worse. So the details of what you actually have going on and what causes those specific things is what's going to make the biggest difference in making your acid reflux go away. So let's look at some of these details to see if we can narrow down what some of the causes are for these high acid states and low acid states. And so as we said, one of the problems is we're kind of treating this grouping of acid reflux as if it's one thing when actually it's like multiple things. But I didn't want to go into too much complicated detail here, so I condensed it all down into high acid states, low acid states. So now I want to look at what some of the symptoms and signs of high acid states would be, and then also what some of the causes for those high acid states would be. So when you're having high acid states, a lot of times there is going to be an overlap with histamine here. So symptoms might include things like anxiety, IBS, like more diarrhea type symptoms. You may have more allergies, eczema, even asthma. All of those things would go along with having more of a high acid, high histamine state. And remember, histamine actually stimulates the cells, the parietal cells in the digestive tract to make more hydrochloric acid. So we know there's significant overlap there. But what could be causing this situation if you are having signs that you might look for in high acid states? Well, they're going to overlap with all the high histamine things. So we're looking to see if your body, your blood is more saturated with histamine. That would lead us to believe that whatever's going on in your digestive tract could be coming from too much acid production. So these might be things like high IgE levels. And if you already know you have a lot of allergies, you can almost expect that these are going to be present to some degree. On the other hand, you may also have problems digesting your histamine, and in that case, you may have a low diamine oxidase level in your blood and in your digestive tract. So that's the high acid state. In the low acid state, you're more likely to have bloating, gas, maybe full easily, maybe even constipation. These people are more likely to have SIBO. They're more likely to be a little bit older as well. And with the low acid state too, we would also kind of clump in there any kind of digestive capacity is kind of low and slow. So this could be lack of bile acids, lack of digestive enzymes as well, pancreatic enzymes. And again, those low digestive enzymes, low stomach acid is going to often lead to dysbiosis or problems in the intestinal microbiome further along your GI tract. And then that's going to turn around and cause more gas and bloating. So some of the causes for the low acid state or lack of hydrochloric acid would be things like stress, ongoing stress, high levels of stress for long periods of time are going to lead to decreased functionality body in the digestive tract, and in particular, production of hydrochloric acid. Sometimes we can get an autoimmune process going on in our digestive tract where our immune cells are actually attacking the cells that make the hydrochloric acid. So these are some of the ways that I think about acid reflux and how I troubleshoot things in my mind. I wanted to see if there's any research to kind of back up or validate this approach. On the low acid side, there have been studies looking at low acid content leading to incomplete food digestion and delayed gastric emptying. And over time, the pressure starts to build up in the stomach, which can lead to relaxing of that lower esophageal sphincter and it pops open. Similarly, with SIBO or bacterial overgrowth, studies have shown that those with SIBO do tend to have acid reflux. Not every person, and some of the acid reflux issues resolve after they've treated the SIBO, and I've definitely seen this in my practice as well. So when there's lack of digestion of food, that can lead to more food for the microbes lower down, which are then going to ferment that food and lead to increased pressure in the abdominal cavity itself. Is a closed system, and when you start to increase gas, you're pressing on that, and that can lead to a increased pressure in the stomach, which can push up against the lower esophageal sphincter as well. And on the high acid side, certainly when people have H. pylori early on, they're going to have more acid being produced by that H. pylori. Over time, though, as the bacteria starts to damage more and more cells, the cells are going to produce less acid. Studies looking at erosive esophagitis have also found that the total amount at baseline for acid in those patients tends to be much higher than controls. And when the cells were stimulated, they produced more acid than the controls as well. And so when we're breaking down this problem, we have to think about what actually is acid reflux. What's the sensation of heartburn and the mechanical movement of the acid into the esophagus? And there's greater or lesser degrees of this. Some people actually have regurgitation. Some people just have a chest pain without even necessarily associating it with digestion. And so we've covered a lot of ground in this video and helping you understand what the causes or potential causes of your acid reflux are. And before I get into the application side of this information to help you get your acid reflux to go away, I just wanted to point out that I do have a course on digestive health that goes into a lot of detail on all things digestive health. And there's one more specific one on post-infectious IBS as well. So feel free to check those out. They'll be in the description. Okay, so now let's look at some applications for low acid and high acid states. First, the low acid state. So remember, these are the people that are going to tend to have bloating. Sometimes they feel like the food is just sitting there. They may get full easily. They may have constipation. Now, of course, all the things that we mentioned for the low acid state and the high acid state, they're not static. You certainly can have a mix and match of these scenarios. But if you find yourself mostly in the low acid state, you want to do things that are going to promote histamine or increase the amount of acid that's going to be produced in your stomach. So these are going to be like fermented foods. Anything that's aged or fermented is going to have a higher amount of histamine in it. So a lot of times people find themselves following a low histamine diet. Well, in this case, you may want to follow a high histamine diet. And you can also do things like apple cider vinegar, lemon juice. These things are going to promote the acid in your digestive tract, in your stomach. You may also benefit from some digestive enzymes in addition to the increased acid states. Initially, you're probably going to want to eat in smaller meals until things are moving in a better direction. There is actually a product called betaine HCl, and that is essentially the same molecule that your body makes in order to digest your food. In cases like this too, I would potentially be doing a low FODMAP or considering doing a SIBO test. So first thing to know about this is you're not doing all these all at once. You need to map this onto what's going to work best for you, what seems to make the most sense. All right, on to the high acid state. So remember, this is the person that's going to be having more allergies, asthma, possibly eczema. They're going to tend to have blood states with higher eosin IgE, and basically anything that's associated with mast cell activation syndrome, we can kind of put that in the high acid state. These are the cases that I tend to think of checking for H. pylori more aggressively because that H. pylori does produce acid and can be a contributor to the overall histamine state. And in this case, instead of following a high histamine diet, you want to do everything you can to avoid those high histamine foods. In that high histamine state too, we're going to get benefit from things like diamine oxidase and other things that generally help reduce the histamine load or help your body break down histamines. Generally, when I'm treating someone for acid reflux, we're going to do some kind of mucosal support. And I think that's more important in the high acid state than the low acid state. But there are certainly things that can apply in the high acid state for one person and also apply in the low acid state. So don't don't think of these as necessarily mutually exclusive, but I think this is useful for sure in the people that find themselves clearly on one side versus the other side. So hopefully that gives you a better understanding of how to make your acid reflux go away. If you do have any questions about anything in this topic, feel free to drop them in the comment section. I'm more than happy to answer your question. And if you want a more detailed custom answer, consider joining the membership program. We'll have more time and attention to dedicate to your question. Now, one question you might want a little more information on after watching this video is what foods make acid reflux worse? Specifically, what foods can I watch out for? And you can find that information in this video right here.